The Newsday continues here on One News Now. I'm Charles Lejano. Some health workers have again expressed dismay over the meager special risk allowance that they received for COVID duty. Marian Enriquez with the story.
Despite risking their lives during the pandemic, healthcare workers are dismayed over the meager special risk allowances they received. Among them is Dr. Beng Rivera Reyes in Camarines Sur, who only got around 2,000 pesos worth of SRA in her 6 months of duty. Some of her colleagues only received 300 to 600 pesos. Others received none. Dr. Beng said the amount of SRA they received may have been computed based on the days that they were exposed to COVID-positive patients and not for the whole duration of their duty. Medical frontliners have time and again appealed that all of them should receive special risk allowances. But for now, they're only entitled to a 5,000 peso SRA. Even the president himself finds this amount too measly.
They should be given more. Take into account the possibility of danger. They themselves will get because of they have to go near and they have to treat those people. I will increase, hindi ko pa masabi magkano.
But the Filipino Nurses United notes that most healthcare workers do not receive any benefits.
Marami pa rin sa aming mga kasamahan ang hindi nakakatanggap o kulang ang natatanggap. Kung kaya't last quarter of last year, di ba, kinalampag namin ang Department of Health.
Another problem is that more and more medical workers are getting sick.
Almost mga 30 to 50% ang nababawas sa manpower nila sa ospital. Kaya ang isa sa mga panawagan ng ating mga nurses ay magkaroon ng augmentation o pagdagdag.
For his part, Health Secretary Francisco Duque III assures health workers that hospitals from other regions can augment the much-needed manpower in Metro Manila. For News 5, Marian Enriquez, we are One News.
Octa research fellow Guido David says he's not convinced that the pandemic is nearing its end. In an interview with us yesterday, David said that it's still unclear whether new variants will emerge and if our current vaccines are sufficient to fight off any future variants of concern.
So yes, we can hope that this will be the beginning of the end of the pandemic. But I personally, am not very, very optimistic. I mean, I want to be cautious about it because we don't know if new variants will arise and how they will behave.
Meanwhile, infectious disease specialist Ron Jean Solante said that getting the Omicron variant will not give you natural immunity against COVID-19. Solante added that we can minimize and mitigate transmission only through vaccines.
Are infected with the Omicron variant, it doesn't mean that you are in your lifetime protected against COVID, because as long as there is mutation, as long as there is community transmission, then you can always get COVID.
Just before the current surge in cases, most Filipinos were already hopeful that the worst of the COVID-19 crisis was behind us. The survey conducted from December 12 to 16 found that a record high of 80% of Filipinos are hopeful that the worst of the pandemic is over. This coming from the 38% that was recorded in September of last year, when a surge in cases was also recorded. The recent figure also surpassed the previous record of 69% from November of 2020. Still, the survey found that 88% of Filipinos are worried that anyone in their immediate family might catch COVID-19. This was 3 points below the 91% recorded in September. Several checkpoints have been set up across NCR borders, including the Batasan San Mateo Road. These checkpoints aim to strictly enforce health protocols amid the ballooning COVID cases in the country. Motorists are asked to present their vaccine cards. Passenger vehicles are checked against overloading. Recall that public utility vehicles are only allowed to carry up to 70% of their total capacity. Many countries are overwhelmed with surges driven by the highly transmissible Omicron variant. But the World Health Organization reminds the public that this new variant is less severe than the previous ones. Let's watch this.
So Omicron, the latest variant of concern the WHO is tracking, has been detected around the world. It is efficiently transmitting, and in fact, everywhere where we have good sequencing, this variant is being detected. So it is circulating globally at the present time. What we are seeing is a very sharp increase in case numbers. You will have noticed in the latest WHO update, almost 10 million cases reported in the last 7 days. And that's the highest number of cases we've seen to date. In the last 24 hours, it's been almost 2.5 million cases, or more than 2.5 million cases. So there are several reasons why we're seeing such a sharp increase in case numbers. First is the emergence of Omicron and the circulation of Omicron, which transmits very efficiently between people. There's a number of reasons for this. First is the mutations that it has. The virus is able to adhere to human cells more easily. It has mutations that allow it to do that. Second is that we have what is called immune escape, and this means that people can be reinfected, either from if they had a previous infection or if they've been vaccinated. Now you have to remember, vaccines are incredibly effective at preventing severe disease and death, but they don't prevent all infections and they don't prevent all onward transmission. So it is still absolutely critical to get vaccinated because it will save your life, but it doesn't prevent all infections or transmission. With regards to the severity of Omicron, we're learning more about this every day. What we understand from a number of countries and the studies that are coming from a number of countries is that your risk of developing severe disease or needing hospitalization from Omicron is less compared to Delta. That doesn't mean that it's a mild disease. It does mean, though, that if you are infected, that your chances of needing hospitalization are less. What we do know also from a number of countries is that your risk of developing severe disease increases with age, and that's the same as with Delta. It also increases if you have underlying conditions, and of course, it's increased if you're not vaccinated. So this is why it is so critical that when it is your turn, that you get vaccinated, that you receive the full dose, because vaccination is saving lives. Vaccination is preventing people from developing severe disease as well as going on to dying, and that's true for Delta as well as for Omicron.
Vice presidential aspirant Kiko Pangilinan has tested positive for COVID-19. Pangilinan's wife Sharon Cuneta confirmed this in her Instagram post yesterday. Cuneta said the senator is the only one who tested positive on his RT-PCR test, but the rest of the family, including their staff, are still undergoing home isolation. Here's a quick look at some of today's headlines. The Philippines logs its highest single-day tally of COVID-19 infections at over 28,700. Bongbong Marcos missed his COMELEC hearing last week because his camp says he wasn't feeling well, yet he granted a live interview on the same day that he was supposedly sick. And Olympic pole vaulter EJ Obena re-injured his knee and has been diagnosed with a small meniscus tear. And those are the top stories at this hour. Join us again later at 10:45 a.m. as we continue to monitor the day's biggest stories. You can also catch One News on Signal Play. Just register for a free account at www.signalplay.com so you can stream One News live anytime, anywhere. I'm Charles Lejano. Mask on, wash hands, and stay safe, Philippines. We're One News.